what's your expectation from the government?
Yeah, so one thing can government do, that they can set up some counseling centers for the people who are having chronic diseases. So if a person is taking prevalence and predictors of depression amongst hypertensive individuals, आवाज आ रही है? Okay, and it is a nationally representative data which I have used LASI data, and almost I have used the 45 years and above. Okay, so why I have chosen this topic? First I will tell you this. So in India, as we all know, that chronic diseases are, as emerging as fast as much we cannot even think. So hypertension is one of them, and it is wholly accountable for 50% of all stroke, or we call it as a heart attack in Indians. 57% due to hypertension only. Okay, yeah, heart attacks, and 24% of all coronary heart diseases are due to hypertension. And also according to WHO, what we have found that if we compare depression, then one out of three people in India is depressive. Every one out of three people in India are depressive. And also, as we all know, that India is a, have younger age population but older age population too. And now a historic population shift is going to happen, in which our older age population is going to expand as compared to younger age. So our older age population will be almost 8 to 10% more as compared to now. So we will be having more older age people as compared to now. So we must focus on the 45 years or plus of people. So what are my main objectives? So my main objective was to examine the gender-wise prevalence of depression. In the, I have categorized into two parts: in 45 to 59 years old, middle-aged people, and old-age people, 60 years plus people, 60 years plus people. Okay. And my second objective was to identify the what are the potential risk factors behind those um, uh, depression among hypertensive. So in a conclude, my sample is only hypertensive people, not the whole sample of India. Among those who are having hypertension only, I have found the depression among them only. Okay. So why there is a need for such a study? So when I was doing the literature of review, I found that mental health was associated with many chronic diseases, as the people who are having chronic diseases like cancer, cardiovascular diseases, they were having very mental health issues, because it's a lifelong disease. You have to take medicine regularly. So sometimes we feel frustrated if we are taking medicine as regularly. It's a part of our life. So, and as soon as we are aging, we are having many other diseases. So mental health and mental health, hypertension and aging, we found a very link between them. And exactly, yeah, that's right. And majority of studies in India were not there. If you will go on Google and search that what is the prevalence of depression among hypertensive people, there is no nationally representative study till yet. So what I have done, I have found, that's why, and I have categorized into two group: middle age group and old age group. So yeah, so what I have done, I have taken this source of data, longitudinal aging study in India. It's a very um, on a large scale study.
Longitudinal aging study in India.
LASI data.
Okay,
Yeah.
it's released by.
It's released by IAPS only.
Okay.
Yeah, Ministry of Health Affairs, and it's released by IAPS only, and it's only for 45 years and above people.
Okay.
Okay. And we divided it into two categories. And what I have applied, I have taken the descriptive statistics and multivariable binary logistic regression I have used. So if we talk about the results, then among hypertensive individuals, 10.6% was the prevalence of depression, which is a very huge number. 10.6% were having depression. Yeah. And if we talk about the older age and middle age, we compared, then middle age was more depressive as compared to the older age. Normally we think that the older people are more prone to depression, but middle age was more depressive. It was almost 11.2%, but the older age was 10.2% only. And among them, if we compare the men and women, then what I found, that men was more depressive in middle age, but as we go to the older age, women were more depressive after 60 plus years. So we can think that what are the possible risk factors, why is it happening? So what I found, that as you can see that here, in men, if a person is highly educated, then he is prone to having more depression. But in women, if she is having less education, then she is more depressive. So education was one of the factor. And also what I found, that if a person is physically Yeah, it was significant. Yeah, and also in middle age adults, if a person is very physically active, he's going for a walk and all, is physically active, then he's not depressive. But if a person is not active, he is only sitting in a one place eating unhealthy things, then he is having more depression. Yeah, in middle age, sorry, in middle age. Yeah, okay. And what I've also found that ki men who had never chewed tobacco, who had never have consumed tobacco, were more depressed as compared to the person who is compared to the person who is consuming tobacco. Only in men, okay. In women, it was not significant. Huh? And what I also found that ki, yeah, hypertensive women who were having other comorbidities like heart diseases, hypertensive she was having, but she was also having heart disease. She was having more depression as compared to the person who is not having heart diseases. So comorbidity was also one of the most factors. Like the person who is having diabetes, heart disease, they were having more depression as compared to the person who is not having diabetes. And in the old age adults, as we can see that almost same factors were there, but the main thing was that Muslim women were more depressive as compared to Hindu women. What we found, yeah, religiously we also found it. The Muslim women were found in women
What are
only.
the reason did you find
We cannot say that ki what are the exact reasons. We can only predict it.
cultural practices?
This can be one of the main reasons, because in the old age adults you cannot say that this is the specific reason. Okay, we can only assume. Okay,
Assume, yeah,
yeah.
there is no
So
data.
exactly. And second of all, if we go to the conclusion only, then we found that middle aged people are more depressive as compared to older age adults. And also those who were working, they were having, the kind of lifestyle, they are having unhealthy food, they are having stress, so this leads to the depression. Okay, the employment factor. And okay, so the main finding was also that ki the people who are living in rural area, they are bound to be more depressive as
In
compared to
rural
the
areas,
urban people. Yeah, exactly. We think that ki in rural area everything is very
related to
peaceful
lack
and
of
calm.
education also.
Lack
This
of
also
healthcare,
lack of
access to
healthcare.
healthcare, because they cannot reach to the doctor. There is no PSC, good PSC as you can say.
Right.
They have to come to the city for their treatment and all. This can be one of the factors.
Socio-economic factors.
Exactly. And being widowed was also one of the most important strongly factor. So if a person is widowed, he or she was more prone to having depression as compared to the person who is not widowed. So if there is no life partner with them, they are having more depression.
More depression.
Yeah. And what I found that yeah. So what is the way forward for it? Finally, what can we conclude? So I want to say that not every single study is for policy recommendation. We cannot say that okay, I have done this study, now make policy according to it. So what we can do is we can sit in our house and ask our mother or father or our grandfather ki, have you taken your medicine? We only ask this question. We never ask ki, acha, you are taking medicine. How are you feeling? What is your mental health? Are you feeling good today? We just ask ki, acha, have you taken your medicine? आपने दवा खाया या नहीं खाया बस. और अगर खाया नहीं खाया तो हम लोग डांटते भी हैं उनको. So we should sit down with them and ask them ki, how are you feeling now? What is your mental health? So maybe this will lower down the prevalence of depression among the hypertensive.
Wonderful research you did.
Thank you
I
so
would like
much.
to ask you about what's your expectation from the government?
Yeah, so one thing can government do, that they can set up some counseling centers for the people who are having chronic diseases. So if a person is taking a medicine for 10 years and more, not short interval, only for more, for like I am taking a medicine for hypertension for 10 years and more, then doctor maybe ask them na, how are you feeling. Doctor can ask, and if they will tell ki, yeah, I'm not feeling mentally very good, then doctors can send them to the counseling centers for
Psychiatrists
counseling,
like social
just
counselors.
to talk with them. Counseling centers that can be set up by government. Yeah, thank you so much.